السلام عليكم أعزائي الطلاب. إن شاء الله اليوم راح نتحدث عن المحاضرة الثالثة للinfectious disease, and we will talk about the toxoplasmosis, and it's one of the high yield subject in the infectious diseases. Toxoplasmosis is caused by intracellular protozoan parasites, which means lived inside the cells of reticuloendothelial system, and it's caused by Toxoplasma gondii and has a worldwide distribution. There are four means of acquiring toxoplasmosis in humans. First of all is by ingestion of infectious oocytes from the environment. Second one, by ingestion of tissue cysts in meat from uninfected animals or from contaminated fruits or vegetables. The third one is by vertical transmission from the uninfected mother to her fetus. Last one, transmitted through an organ transplantation from an infected donor. لو نلاحظ هنا باللايف سايكل مال توكسوبلازموسيس راح نلاحظ انه طرق الانتقال the way of transmission of the infection by first of all vertical transmission or congenital infection, second one by transfusion or transplantation, the third one by oocysts from contaminated food, water or soil, or by eating tissue cysts from pork or sheep. So the infectious agent is the oocysts or tissue cysts ingested fecal-orally, and it will be replicated inside the duodenum and then transmitted to different tissues in our body. But the sexual phase of parasite accomplished inside the domestic cats. So the source of the infection is from the cats or other animals. Immune competent persons with a primary infection are usually asymptomatic. Major persons are asymptomatic, especially immune competent one. However, in some immune competent hosts, Toxoplasma gondii infection can present as an acute systemic infection, which typically develops 5 to 20 days after exposure to the organisms. Such patients typically present with constitutional symptoms and bilateral symmetrical non-tender cervical adenopathy. For diagnosis of toxoplasmosis, serologic testing is typically used to confirm the diagnosis. Sometimes we need lymph node aspiration or biopsy as part of diagnostic evaluation, especially in immune-compromised one, because there will be no antibody reaction or immunity in the immune-compromised patient. So in biopsy, we will notice the tachyzoids. The tachyzoids can be identified with fluorescent antibody stains or immunoperoxidase. Most immune-competent non-pregnant adults don't require treatment for acute infection since the disease is typically self-limited. However, sometimes suggested treatment for those with severe or prolonged symptoms beyond a few weeks. If treatment is indicated for acute systemic infection, a pyrimethamine-containing regimen with either sulfadiazine or clindamycin is typically preferred. However, if pyrimethamine is not available, cotrimoxazole can be administered. The duration of treatment is usually 2 to 4 weeks. The prevention should be taken to reduce the incidence by toxoplasmosis by cook meats to adequate temperature, usually 63 Celsius degrees for ground meat, and poultry 74 Celsius degrees. If the meat is not going to be adequately cooked, it should be frozen at sub-zero temperature for several days. Number 2, wash cutting boards and/or other kitchen utensils with hot water and soap after contact with raw meat or shellfish. Number 3, avoid unpasteurized non-bovine milk. Number 4, wear gloves and/or wash hands with soap and water when there is contact with soil or sand that could be contaminated with cat feces. Last one, wear gloves and/or wash hands with soap and water when there is contact with the cat's litter of cat that forage outdoors or eat raw meat. Indoor house cats that are fed dry or canned processed cat food do not pose a risk.